single day, like I've always done and always will.
Passing these bills on the floor, making yet another stand.
Welcome to this week's edition of New York Now. I'm Chantel Destra. This month marks the 35th anniversary of the Americans with Disabilities Act. This law is a federal civil rights policy that was implemented in 1990 and is meant to protect people with disabilities from being discriminated against. In New York, the State Office for People with Developmental Disabilities commemorated the anniversary this week and is vowing to uphold the tenets of the federal policy in the years to come. The office is also sounding the alarm on how federal cuts to Medicaid could also impact New Yorkers who are enrolled in the program and balancing the challenges that come with finding suitable care for disabilities. In this next segment, we sat down with the newly appointed commissioner of the department, Willow Baer, to discuss the impact of the policy and her plans for the office. Here's that conversation. Thank you so much for joining us here today, Commissioner.
Thanks so much for your interest and for the invitation.
Yeah. So as the newly confirmed commissioner for the Office for People with Developmental Disabilities in the state, what can you tell us about your journey to becoming commissioner and your plan for the office?
My journey to becoming commissioner was very unexpected. I am a recovering attorney, so I'm an attorney by trade. I served as counsel to the agency for a number of years, as well as assistant counsel to Governor Kathy Hochul for 2 different terms. Came back to the agency into the operational role about a year and a half ago. And the then commissioner decided that she was going to sort of retire, move on, focus on her home life and family. And I had the unexpected opportunity to step up into this role. And it has just been the honor of a lifetime. It's been incredible so far.
Yeah, and what are your plans for the office?
I want New York State to remain sort of a leader in the disability services world. I'm so proud of the work that we've done, but as a system, we are at like a midlife crisis. We're a relatively new system throughout the country in terms of having people with disabilities really community integrated, getting jobs, living their best life in the community. And I am really excited to move into the future, into the next wave of what this service system can look like to make sure people really are living the same life that anyone else has access to. So I'm really proud to be at the sort of helm of the next wave of that transformation.
And how do you think your tenure as commissioner will be different or unique to the tenures of those before you?
Well, that's a great question. I think everyone is different. Everyone brings a little something different. I really come to the system from the role of an advocate and as a family member. So I'm the family member of someone with a developmental disability served in the system. And so my focus right out of the gate was to make sure that we had family stakeholders and self-advocates at the table to help us develop policies and to really understand the customer experience of the service system. And so I think that sort of vision as an advocate is what I build into everything I do and hope to be sort of the lasting legacy of my leadership.
And July marks the 35th anniversary of the Americans with Disabilities Act. What does that milestone mean to you and your office?
It is, and thank you for highlighting it. It means everything. I was in Austria not that long ago at a conference filled with people that were disability advocates from all different countries all around the world. And the United States really is still the North Star in terms of disability access. And it's because of things like the ADA, which really we only have here. Many other countries don't even have an ADA yet. We're really excited to be celebrating that event in the plaza and to be focusing on what we have done in this state over the last 35 years. It is everything to the disability rights community and to our agency in particular. We want people with developmental disabilities to have access to anything you or I would have access to. And the ADA is really at the heart of everything.
Yeah. And I wanted to ask you about the legacy of the Willowbrook State School. Now, we know this was a state-owned facility that would house children with developmental disabilities. It was closed down after several reports of just neglect and deplorable conditions for the kids in the school. What does the legacy of Willowbrook mean to you, and how does that sort of shape the way that you're going to approach leadership?
The legacy of Willowbrook is hard for New York because it immediately conjures this image for anyone. You hear the words Willowbrook, you remember the documentary, you remember those images and those sounds, right? And it was awful. But the closing of Willowbrook really sparked an international movement, and that started here in New York, right? In terms of deinstitutionalizing people, moving them out of those horrible conditions, moving people out into community residences, taking people out to volunteer, right? And so that marked really the start of everything that my agency does, and is such a rich history, but such a dark history, right? We this year, in this year's enacted budget, actually have an incredible investment from the governor and the legislature to build a Willowbrook Center for Learning in Staten Island, where we're renovating the last building left on that state campus that needs that renovation. It's still sort of stuck in time. It looks the same as it did then, and it's a terrible reminder when people drive past it. So we have this incredible investment to update the entire campus, to really make some modernizations, and in that building in particular, to build a Willowbrook Center for Learning where we can bring artifacts and timelines and really honor that history in a positive way and really highlight how much growth has happened since then.
And if someone wanted to report neglect for a person with developmental disabilities today, is that something they could do with your office, or would it be another state agency like the Inspector General's office?
So the New York State Justice Center was launched in 2013, and all allegations of abuse and neglect, not just for my system, but for other systems that serve vulnerable populations in New York, the New York State Justice Center houses sort of that reporting process. Reports can be made to us directly. We make reports to the Justice Center when we need to, but they sort of maintain that process to make sure that everything is reported and reviewed from a neutral third party.
And when it comes to the work of your office, is there any overlap with the Council for Developmental Disabilities? Absolutely.
So our partners at the council really oversee the grant process. They have federal funding. They're in charge of the federal funding component of the Developmental Disabilities Service System, and they review grants and initiatives. And so we really work in partnership with them. They are their own agency. They have their own director. She does incredible work and brings a wealth of experience to this field. But they are incredible partners in terms of sharing their research, sharing their resources. We talk all the time about what my priorities are and how they can be of assistance and vice versa. So they're an incredible partner here in New York.
And you mentioned federal funding and federal policy, so I wanted to get into President Donald Trump's Big Beautiful Bill. Do you see that federal policy having any impact on the work that you're doing?
Absolutely. Absolutely. There's no way it couldn't. Mm-hmm. So we know that the impact of that bill will look like almost $14 billion in Medicaid cuts to New York State. So that is largely in health and hospital systems, but you can't cut $14 billion of health care in New York State and not impact people with disabilities who also rely on Medicaid for those health services. People with developmental disabilities in particular already have a very hard time finding medical providers, dental providers, appointment times, offices that are wheelchair accessible, for example. Our population has a hard time accessing healthcare, and this will make it 100 times harder for them. We rely on $7 billion of Medicaid just to serve people with developmental disabilities in New York alone. So when you're looking at $14 billion overall being cut out of the Medicaid budget, it will absolutely impact everyone that we work to serve, as well as all of the people that work really hard to support people in the system who are overall a low-income workforce, right? So it'll absolutely have devastating impacts across the state.
And when it comes to state funding, do you think the state is giving you enough in financial resources to support the work that you're doing?
So under this governor, we have had incredible investments over the last 4 years. Governor Hochul's invested $4 billion in new funding just to our service system in the last 4 years by way of cost of living adjustments and workforce bonuses, and the $850 million investment we made recently to our nonprofit provider system. So we have been doing incredibly well in the last few years in my system, really catching up to the cost of doing business and making really intentional investments in places where historically have been underinvested. That being said, with a $14 billion cut to Medicaid coming up, the New York State, no matter how good a financial state we're in, is never going to be able to make up that loss of funding.
And lastly, what are some of your long-term goals for the office? How are you hoping that the state will continue to support people with developmental disabilities in the years to come?
I think we're really on a great track. We have a really robust strategic plan that we've been working on over the last few years that really set out short-term and long-term goals for the agency. Like I said, I've been really intentional about involving self-advocates and family advocates and developing better relationships with our nonprofit providers to make sure that they feel very supported and that the direct support staff that work really hard every day across the state to support people feel supported and have the resources to do the job they need to do. So I'm very excited to just continue that work, driving forward our strategic plan, making sure people have what they need to really live integrated lives and to increase the number of people employed. That's an area in New York State where we've historically not done a great job of making sure people with disabilities have access to meaningful employment. So we're very focused on driving that forward this year as well.
Well, unfortunately, that's all the time we have for today. Thank you so much for joining us today, Commissioner.
Thank you so much for having me.
Of course. And we were speaking with Willow Baer, Commissioner of the New York State Office for People with Developmental Disabilities. And for more on our conversation with the Commissioner, you can visit our website. That's at nynow.org. Now turning to another important topic. In New York, state lawmakers and healthcare advocates have been pushing to improve workplace conditions for nurses across the state. They say that the state should be doing more to establish workplace violence prevention programs and address incident reporting issues in hospitals. The two bills that would address those issues have been passed in the legislature, but need to be signed by the governor before they can be enacted. In this next segment, our Elise Klein dove into the impact of those bills. Here's that story.
At a time when more than 81% of nurses nationally experience physical violence at work, state lawmakers are trying to reduce incidents in New York. In the most recent legislative session in Albany, state lawmakers passed a bill to require hospitals to establish a workplace violence prevention program. If the law is enacted, the program would require hospitals to develop a workplace safety and security assessment and a safety and security plan. Assemblymember Catalina Cruz, a Democrat representing parts of Queens and a lead sponsor of the bill, says the goal of the bill is to dramatically reduce the high percentage of nurses and healthcare workers harmed on the job.
No, the idea that you can go and try to save someone's life and instead you're going to end up attacked, it's not something that I think any of the nurses or doctors who support that are wanting or expecting, and that should not be part of the everyday work that they are doing. So we want to make sure that we're impacting it positively.
Tanya Basil, registered nurse at Albany Medical Center, says workplace violence is a big contributor to nurses leaving the job altogether.
It is one of the things that makes us rethink the decision for becoming a bedside nurse.
According to a study from the National Library of Medicine, it's estimated that about 17% of nurses leave their jobs every year due to workplace violence.
It's been the gamut. I've been kicked, punched, scratched, had feces thrown at me, threatened for my life.
Basil has been a nurse for nearly 30 years. She says she has considered leaving because of workplace violence. What stopped her? The purpose to care for her patients.
Nursing is challenging in many, many ways, also rewarding in many, many ways.
And Basil isn't alone. Nurses and healthcare workers often experience this kind of violence regularly. Some have even lost teeth and their memory as a result of attacks. Juliet Naples, a registered nurse in Buffalo, says dealing with workplace violence makes the job so much more difficult.
Just within my unit, we have had parents that have, been verbally abusive. To the point where they've, charged or walked towards a physician and or a nurse. We have a great security team that responds fairly quickly, but we need to implement more safety measures.
Basil stresses that the current system in hospitals for reporting incidents of violence is not working. She says nurses complete what's called an SI, or internal document, related to patient care and safety, but she says they don't ever know the outcome after.
No one gives us feedback as to what's being done, what will change, what we'll do differently. We don't hear or see any of that. And because we can't do anything as a nurse to hold management accountable for all of this stuff, we just live in the circumstances repeatedly.
Basil says this bill, if signed into law, will help establish a system of accountability.
And with these laws, it will have like a regulatory place to present these problems, and they'll make us come up with plans that will to help us alleviate or reduce these problems.
Naples says nurses and healthcare workers see people in their most vulnerable times, and consequently, that can lead to high emotions and violent behavior.
It's a difficult time, usually at their sickest time. And so it's really important that we have legislation that supports protecting our healthcare workers. Unfortunately, it is one of the highest jobs that there is workplace violence.
The bill passed both chambers nearly unanimously this year after failing in previous years. Assemblymember Cruz says this year the bill had more support from healthcare groups like the Emergency Room Doctors Association, 1199, and the New York State Nurses Association.
Having them come to us and saying, we need this and we're going to help you pass this, was a big tipping point to ensuring that the legislation passed.
Helen Schaub, 1199's political director, says the bill was stronger this year than in previous years, including more provisions allowing frontline workers to be involved in conversations about safety plans.
So that was something we came to the table and said, look, if you're going to do this, you have to talk to the people who are facing this every day and make sure they're consulted, both in being able to analyze what the problems are, what the vulnerabilities are, and then how to respond to it. So I think it was really everybody coming together.
Schaub says these safety plans should be more than just paperwork.
It is really about how do you make sure that there is adequate attention and effort to really analyzing what's happening, to looking at incident reports and the frequency of incidents and when they're happening, on what shifts, on what units, and then using that concrete information as well as the direct feedback from workers who are kind of in the line of fire.
Many state lawmakers are hopeful the bill will be signed into law by Governor Kathy Hochul. Assemblymember John McDonald, a Democrat representing parts of the Capital Region, says this bill is important and will ultimately improve the environment for patients and workers in hospitals.
The idea to have a process in place where, there's a collaborative approach towards developing a plan, and then a more collaborative approach towards investigating incidences and having follow-up. I think it only serves the whole community within that hospital or healthcare facility for the better.
The bill also has bipartisan support in the legislature. State Senator Rob Rollison, a Republican representing parts of Orange County and a co-sponsor of the bill, says this bill is just common sense.
We certainly, as a state, have a responsibility to prevent violence, to assess violence, to make sure that everyone has a safe workplace, right?
And this isn't the only policy measure to address the issue. Some lawmakers are also hoping another bill addressing workplace violence is signed into law. State Senator Patricia Fahey, a Democrat representing parts of the Capital Region, is hoping the bill she sponsors, aimed to improve the incident reporting processes, will be implemented along with the Workplace Violence Prevention Program bill. The senator's bill would allow for victim statements following an incident to be taken at their workplace instead of a police station.
Letting the nurses and health professionals know we have your back. We are going to make this easier for you to report because it's unacceptable. Any form of violence, let alone workplace violence, is unacceptable. This is the first step to stopping it.
Naples says this bill, if signed into law, would help foster healthcare workers' relationship and trust with law enforcement and encourage better reporting.
Having law enforcement come to the facility or take the report within the time frame that it happens is crucial. I believe there will be more compliance in that regard to be able to report things in real time and truly feel supported by our local law enforcement.
Rawlson, as a former police officer, says it's important for victims to feel comfortable and safe. The bill was also passed unanimously and currently awaits the governor's review.
I don't think there's anything in that bill will prevent the governor from signing that as well. And of course, I support that, and I appreciate my colleague, Senator Fahey, bringing it to the floor.
While many healthcare workers feel better safety and incident reporting plans will ultimately help address workplace violence, there is another element that the state struggles to address: staffing. Many nurses and healthcare workers say the staffing levels in hospitals are unsafe and add to the workplace violence issue.
It's hand in hand. It's part of the whole picture of safe care within a hospital. You have to have ratios that allow you to safely address all of your patients' needs, as well as you have to be physically safe.
The state established a safe staffing law in 2021, but many hospitals throughout the state still struggle to comply. The law requires hospitals to create a clinical staffing committee to create and implement staffing plans, which have to be submitted to the New York State Department of Health every year. The Department of Health is responsible for enforcement, investigating violations, issuing penalties such as fines, and resolving complaints. Last year, Albany Medical Center was fined $375,000 by the Department of Health for failing to staff their hospital safely. In 2022, Bellevue Hospital Center in New York City was cited for failing to deliver safe staffing. In a statement sent to WMHT, the CEO of the Albany Medical Health System said they are committed to improving and investing in the workforce. Bellevue Hospital Center said in a statement they address all citations in accordance with regulatory guidelines. Schwab says she hopes this enforcement leads to improvement.
I hope that they take it very seriously. They recognize that a fine like that means that they have to do better, and that they do better.
Basil says while the safe staffing law has helped the enforcement process, the Department of Health could be doing more. She says she shares frustrations voiced by big unions like CWA, complaining about thousands of staffing violations filed with the Department of Health that they say have not been addressed. From 2022 to 2025, about a handful of hospitals were fined or cited for failing to deliver safe staffing, according to Department of Health public records. Basil says it wasn't until the New York State Nurses Association got involved that they were able to get results, and many healthcare workers across the state don't all have representation from big unions.
We've been doing what they call POAs over the years, many times. That's complaints of assignment to the DOH, but nothing comes of it until you have a huge entity, a strong force behind you that puts weight on the regulatory systems, the DOH. Again, nothing gets done.
Naples says healthcare workers would like to see more enforcement of the 2021 safe staffing legislation.
We have filed with the DOH for violations of our staffing ratios and staffing law. We'd like to definitely see a return on that, an actual enforcement of what was promised.
In a statement sent to WMHT, the Department of Health said they have resolved thousands of complaints over the last 3 years, and they continue to provide accountability. The Department of Health said they investigate all complaints and have resolved more than 50% of the thousands of complaints received. Some lawmakers like Senator Fahey say the implementation of safe staffing in New York has been slow, largely due to COVID and staffing shortages. Fahey also says she's worried about how safe staffing could be impacted in the state after the passage of Trump's Big Beautiful Bill, which eliminates federal safe staffing standards for nursing homes.
So I'm actually very worried that at the federal level right now, the Big Beautiful Bill, or Big Beautiful Betrayal, as I call it, may lead to even more rollbacks in moving toward safe staffing. We're still digesting that, but it looks like, at least for nursing homes, I think they've eliminated safe staffing standards.
State lawmakers will certainly have a lot to discuss in this off-session time ahead of the next legislative session. The workplace violence bills haven't been delivered to the governor's desk yet, and at this point, it's unclear when that will happen. Once they are delivered to the governor's desk, she will have about 30 days to review them. Elise Klein, New York Now.
And for more on workforce protections for nurses in the state, you can visit our website. Again, that's at nynow.org. Now turning to our last topic. This week, former Governor Andrew Cuomo officially announced his decision to run in the general election for New York City Mayor. The move comes about a month after the former governor lost the Democratic primary from mayor to Assemblymember Zohran Mamdani.
I am truly sorry that I let you down. But as my grandfather used to say, when you get knocked down, learn the lesson and pick yourself back up and get in the game. And that is what I'm going to do. The fight to save our city isn't over. Only 13% of New Yorkers voted in the June primary. The general election is in November, and I am in it to win it. Every day I'm going to be hitting the streets, meeting you where you are, to hear the good and the bad, problems and solutions. Because for the next few months, it's my responsibility to earn your vote.
As we've discussed on the show, the former governor has been trying to launch a political comeback after resigning as governor in 2021 amid sexual harassment allegations. The former governor will be going up against Mamdani, incumbent Mayor Eric Adams, Republican candidate Curtis Sliwa, and independent candidate Jim Walden. We'll continue to bring you updates on this race in the coming weeks leading up to Election Day. You can also subscribe to our newsletter for exclusive content by going to newsletter.nynow.org or by scanning the QR code on your screen. Well, that does it for this edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,